Today, we're going to talk about an important public health issue that's resulted in 38,000 lives lost in 2016, according to the CDC. But we're not talking about diabetes, the flu, or kidney disease. We're talking about gun-related violence. Joining me today is Dr. Garth Graham, president of the Aetna Foundation and vice president of community health for Aetna. Dr. Graham, thank you for joining me.
Thank you for having me, Jonathan.
So why should we consider violence and gun-related violence a public health issue?
Because of what you just said. Anything that takes 38,000 lives in the United States in a given year makes it a public health issue because it impacts the health of the public. Public health is very much focused on the preventative portion. So we think about things that we could have done to prevent the loss of life, but also to improve the quality of life. But the real thing I always think about is every time I see an aspect or a patient or an individual impacted by violence, I think that's preventable. I think there is something along the chain of events that led to that actual incident where we as a system, we as a clinical or a public health community could have potentially intervened to prevent that from happening.
Are there significant differences between the weapons that are often associated with mass shootings and other weapons of violence that perhaps have less capability, a handgun or a knife?
You know, certainly mass shootings capture our attention. What is happening every day in many communities in terms of local violence is also important. There are a huge cadre of individuals that are injured and taken out of the workforce, taken away from their families. But there's also another side of violence that we often don't see, and that's the people who see it. And this concept of post-traumatic stress disorder, and much of what we see in many urban communities where people go through a cycle of PTSD. They've seen something, they see it again, they get re-exposed in a different way.
The Aetna Foundation is working with several groups that are dealing with violence as a public health issue. What are we doing with them specifically, and what can we learn from them?
So in Kansas City, there is a group that's using the CDC Aim for Peace program. And what they're doing is they're treating this, like we were discussing here, as a public health issue. So how do you identify the risk factors as you would in diabetes? How do you then look at intervening as we would in diabetes and obesity? And then how do you teach a community how to deal with these challenges, much the same way we would treat any patient who has a risk factor for any particular illness. Another example, and this comes from a group out in Philadelphia, Dr. John Rich and the folks working at Drexel University have really looked at this issue of repeated post-traumatic stress disorder, so the invisible wounds. And then how do you go back, as you would with, if somebody's had a heart attack, how do you prevent a second heart attack? How do you prevent, the family history of a heart attack has now been created? And so how do you then deal with that? They've seen so many things, experienced so many things that they may either mimic something they've seen or react in an overexposed way because of something they've seen before, as you would any individual who has seen war. And so treating them appropriately, not just as criminals, but understanding that many of them are victims, is making sure that we understand the appropriate response.
You know, you often speak of the social determinants of health. How do social determinants impact or relate to violence?
So looking even at the basic infrastructure of a community, the places where people can go and have safe interactions. The kinds of places where people can de-stress is particularly important. But making sure that people have adequate economic opportunities, education, housing, transportation, and looking at even just the basic necessities of life. Again, we know that that applies to diabetes and hypertension, and I would venture to say the data shows it applies in very much the same way to community violence. I think education is still one of the best ways to fight chronic diseases. That's because education creates economic opportunities that creates an avenue for better choices. Much like I would say the same in this situation when we think about the public aspect of violence. How is it that we can improve our schools? How is it that can we improve the living conditions that people have to be a part of, the environment around them?
So many of us have a personal connection to violence, either directly or indirectly, friends, family that have been impacted. What's your personal connection to it?
You know, I think, like many people who have immigrant backgrounds like I do, where you come into a not necessarily economically ideal situation and you see a lot around you. One of the most interesting personal things I've seen people who are victims of violence, and I've also had friends who have been perpetrators of violence. And so I think for me, it's allowed me to see both ends of the coin and to understand, again, this is not a random thing that just happens. There's a sequence of events, much like any clinical entity, sequence of events from risk factors, environment that leads to the outcome, and sequence of events that many times leads to a violent situation within a community.
You know, I read in one of the articles that you've written, you looked towards social groups and the impact that one person can have within the social group when it comes to violence, and in particular gun violence. Tell us about that.
So people who are in social groups where they have been exposed to violence have a close colleague who has either been a victim or been a perpetrator of violence, makes it more likely that they themselves will either become one of those two, either victim or perpetrator. And in many communities, the line between victim and perpetrator, though very real in terms of the consequences, the risk factors are very similar.
So, Dr. Graham, what is your vision for how communities can really make an impact?
You know, when I think of the definition of a healthy community, I think of an empowered community where individuals, regardless of their zip code, can enjoy a long and healthy life and do the things that they want to do. And I think about community-based solutions, empowering the community to do the kinds of things so that each person in the community, each family, each individual can live a long and healthy life.
Dr. Graham, thank you so much for joining us today. This has been a great conversation.
Thank you for having me.
Gun-related violence is an incredibly complicated issue with many interconnected elements. However, if we view it as a public health issue and take the same sort of approach that we do with other chronic health care conditions, we have the opportunity to play a role in addressing this problem. Through community-based solutions like the ones Dr. Graham described today, we can help address health disparities and reduce violence in our communities and throughout the country.